Today I want to talk about 3 simple ways that we can reset the gut. We need to understand right now that your gut health is related to everything happening in your body and in your brain. Not a day goes by where we don't see the connection of the gut with autism, ADHD, cognitive brain decline, Alzheimer's, dementia, Parkinson's, every single cancer, diabetes, cardiovascular disease, hormonal balances, ovarian problems, uterine problems, obesity, the inability to build and maintain muscle. Your gut is your second brain. Your gut regulates hormones and a lot more than we think. A lot of people think, and for the longest time we thought that the gut was just digestion, but it's way beyond that. And there are so many cases that come to us, complicated cases, and sometimes only when we reset the gut, everything starts to get better. Symptoms start to disappear so doctors can start to reduce medication. And that's the beauty of holistic medicine and lifestyle medicine. You got to identify the root cause of the problem. So today we're confused in a world with so many prebiotics and probiotics and all of this microbiome testing and fecal transplants. I mean, all of them have their place, but we can't go on just promoting stuff without understanding what's happening within your body. So we're going to talk about 3 simple ways that we can reset our gut if we have a gut problem. How do we know we have a gut problem? You have a change in your bowel movement, either IBS-like symptoms, always loose motions, always constipation, chronically constipated, or you have a lot of acidity, you have difficulties digesting food. The foods that you could eat 5 years ago, all of a sudden you're intolerant towards it. You start having this constant abdominal pain, this feeling of pain and discomfort in your gut. Your skin starts to change, your hair starts to fall. There could be several reasons, but your gut is involved. So number 1, let's talk about simple, common sense ways to reset the gut. What does the gut need? It needs a break from food so it can heal itself. Your gut has a healing mechanism already in place, like the body. And the same way we got to rest our muscles, rest our physical body, rest after a surgery, your gut needs rest so it can do its job of replenishment, repair, growth, and regeneration. So the number 1 thing that we're going to look at are keep gaps between your meals. Stop snacking. Stop snacking. You've hardly finished a meal and you're snacking. You've not even finished digesting your snack and you're eating your next meal. So when does the gut get its space and its time to heal, repair, and regenerate? Within the gut, we have something like a housekeeping team. It's called the MMC, the Migratory Motor Complex. Think of it as like a housekeeping team. 90 minutes to 120 minutes after a meal, the MMC gets activated and there's this whole sweeping effect that happens across your gut, automatically cleaning it and doing the work that it's supposed to do. Now, because we're snacking, we miss that 90-minute period, that 120-minute period, we never really activate the MMC, and that creates more problems for us. So number 1, keeping gaps between your meals, healthy gaps. Of course, if you're on medication, you're highly acidic, you're highly diabetic, and you're supposed to eat consistent meals, then do that. But for everyone else, stop snacking. A good gap of about 4 hours is usually ideal between meals. And of course, you can use your body's mechanism. Eat when you get hungry. When you're hungry, your body's asking you for more food. Not emotional hunger, physical hunger. Number 2, your last meal of the day and your next meal of next day. Try to keep at least a minimum gap of 12 hours. Minimum gap of 12 hours. If you can do 13, great. Some of you can do 14. Some of you can do 16. Don't push it. It's not a competition. But keeping that gap between your last meal and your first meal of next day gives your gut enough of time to regenerate, repair, and replenish. The third thing, how do you add diversity to your diet? Can you make your plate look colorful? The more colors we eat, the more diversity of food, the more new vegetables we try. That's why I always tell people, when you travel to a new place, try to eat local. Because the moment you start to breathe the air of the new place you're in, your microbes start to change. So try to eat to feed your microbes. Don't eat to feed you, eat to feed your microbes. What do your microbes need? Diversity, colors. How can you make your plate colorful? So many different colored vegetables, so many different colored fruits, nuts, and seeds. Add more color. The more diversity you have in your microbiome, you have more microbes that help you digest better and assimilate food. Many of you would have realized this time where you could eat so many foods and now you can't, or some people have to just eat minimum food because their gut just can't stomach anything anymore. For these people, there are many ways you need to look at it. For the people who come to us, we see a decrease in mucosal lining because they've overdone it on certain medications or painkillers. For some people, they've just gone on these weird fad diets that minimize what they eat. The diets have given them weight loss, but it's destroyed their gut health. Now, when they're trying to eat foods, they don't have the microbes to break down these foods. And that's why you need to slowly introduce one food at a time, repair the mucosal lining, add another food. Like in patients of colitis, Crohn's disease, it's so important to build the building process very, very slowly. Why is it slow? Because you're trying to get more microbes into the gut. After a while, you will be able to eat all the foods that you couldn't eat, unless of course you're allergic to it or you also have a liver problem. So these are 3 things that you can do for your gut health. Number 4 was simple. Cut out the stuff that is ruining your gut health. White sugar, white flour, processed, junk, refined. If you can't cut it out, keep it to a minimum. A minimum. Just by doing this, you allow the healthy bacteria to grow in your gut. Every time you eat more sugar and white refined foods, you're feeding the bad bacteria, which now starts to overpower and overgrow the good bacteria. That's why you get bloated. That's why you have this sense of discomfort in your gut, your stools change and everything else. So these are quick ways that you can reset. Look, go to the supermarket, go to your vegetable vendor, look at the colors of vegetables. How can I start introducing a new color every day? How can I start increasing the diversity in my food? Because the more colors you eat, the stronger your gut. And then of course you have your natural prebiotics and your probiotics, your onions, your garlic, your apples, your high fiber fruits, and then your kimchis, your yogurts, your coconut yogurts, your dairy yogurts, depending on what suits you, your sauerkraut, your pickles, your fermented foods if they suit you. So remember, some people could eat fermented foods and all of a sudden they can't eat fermented foods. This is a sign that your gut needs to be. It's very, very important that we understand these things. Your body's always talking to you, and this is how you build great health. And the last point, if you're chronically stressed, you're going to have poor gut health. So learn to calm down, learn to relax. There will be stress in your life, but how are you relaxing? How are you taking it easy? How are you breaking it down? Break down that stress, learn to breathe deeply, learn to do things that you like, do your gratitude practice. All of this keeps you calm and your gut behaves better. If you're a patient of depression, please understand you will have gut problems. And by improving your gut problem, there is a huge chance that the way you feel can even get better. Have a great day, everyone. Until next time, eat smart, move more, sleep right, breathe deep. And remember, you care is all about you.